The use of addictive substances such as alcohol, tobacco, illegal drugs, and opioids during the adolescent years has been shown to interfere with brain development, reduce academic performance, and increase high risk behaviors that can lead to accidents, serious health conditions, homicide, and suicide. The Substance Use Disorder Prevention that Promotes Opioid Recovery and Treatment for Patients and Communities Act of 2018, also known as the Support Act, was signed into law by President Trump in 2018. An overview of the act is that it provided a tighter oversight for the distribution and production of opioids. It imposed additional opioid reporting safeguards. It limited coverage for prescription opioids, and it expanded the access and coverage for opioid addiction and treatment services. Although this act was not specifically designed to target the adolescent population, it does address them in a few of the sections. One section of the act requires that the Secretary and the Surgeon General submit a report to Congress about the effects on the public health of synthetic drug abuse among adolescents, in order to better educate the parents and the public on the effects of these drugs. Another section of the act requires the Secretary of Education to disseminate best practices and to issue grants for the prevention of and the recovery from substance abuse among adolescents. I think that this act supports public health promotion in many ways. It helps to combat the opioid epidemic from multiple directions by promoting prevention education, spreading awareness, and removing treatment barriers. The Support Act has been instrumental in securing the funding needed to raise public awareness about this epidemic. For example, the Centers for Disease Control and Prevention have been able to provide over $155 million to different states since the enactment of the Act, in order to help them improve prevention strategies and increase public awareness. Raising public awareness and providing educational material specifically about these new synthetic opioids that less is known about can help parents and healthcare workers combat this epidemic and ultimately save the lives and the futures of our adolescents.